We're working on something special for February that's very close to us personally. It's centered around care over time, the kind that's quiet, consistent, and intentional, the kind that's simply there. It comes from the products that we've created, use ourselves, and stand behind every day, and from the belief that real care is built through small, daily choices and routine. This is an inside look into our own routine, and we're very excited to share it with you in a very special way. So stay tuned. We will be launching in February. Okay, Joe. First of all, long time coming.
Yes.
This podcast. So welcome to the Biohacking Beauty Podcast.
Thank you. Happy to be here.
And, before that, Jackson, shout out to Jackson, the producer, asked how we got to know each other, and we couldn't figure that out. But, I think the best thing that I can say about you is that Anastasia and I choose you, or, R3 MedHouse, your facility, to be the place where we get microneedling, and that we did a lot of content around that. So That should say, that should be the best compliment someone should give.
It is. We definitely take that as the highest compliment for you in particular. Yeah.
Tell me how, you are, most people listening to this podcast who are not maybe like the bleeding edge of practitioners doing microneedling, wouldn't know you by name or wouldn't know your face.
Yeah.
But we know, and people who are in that space, we know that you are some sort of the poster child of the cutting edge approach to microneedling and the adjunct treatments according to that. Yeah. So how did it come about that you became a leading voice in that field?
So I've been in the integrative and regenerative medicine space now for 15 years, which is kind of a long time in the sense that the scope of healthcare really has emerged probably, I don't know what your opinion is, but really 3 to 5 years. But I've been here 15 years. So it's kind of just been a natural progression. And my clinical background is actually orthopedics and plastics and reconstructive. And so that's kind of where the beauty piece comes in, and the aesthetic piece is my experience and background in plastics and reconstructive surgery. So, morphing integrative medicine with my background in orthopedics and reconstructive is really how we came about in the aesthetic space, for sure.
It's super interesting because it might seem, so reconstructive might seem like out of all the plastics, might seem maybe the furthest away. And maybe some people wouldn't figure out how orthopedics has got to do with it. But really, these are the two, people need to understand that cosmetic plastic surgery or beautification, let's say through intervention, isn't a classical medical field. It didn't emerge out of necessity. There was no precursor to that like 100 years ago, like most medical professions. It's really like Becker and Gordon, like these two plastic surgeons, in the 80s, learning arts and figuring out really making up ratios, which turned to be that they're pretty much correct. As far as like how symmetry in the face should look like and what would resemble beauty, right? They deconstructed beauty. But the cool thing about the two angles, the two vectors you're coming into this field, it's like, how do we put things in the right place? And orthopedics is like, how do we make it stick, or how do we make the body respond in the right way where it then functions properly, right?
Yeah. And just knowing someone's individual anatomy.
Yeah.
Right? Like knowing where things are, where they're supposed to be, and then they're on the reconstructive side, like, okay, how do we put them back there? And so it's been a huge catalyst for our company and our practice, but specifically in the beauty space in particular.
So how does so you come from these two fields, and how does one then kind of go through that funnel of becoming, or how does it translate at the end? How do you take that knowledge and translate it to, applying it in these these non-invasive interventions that you are now a specialist in?
Yeah, so really both approaches, right? So orthopedically, we look at the body as one kinetic chain of energy, right? And the same thing with kind of plastics and beauty. We know that we age from the inside out, right? And so we have to address all of the physiological components inside so that the facade on the exterior looks beautiful like we want.
Yeah.
And so we've well, my background has allowed me to kind of blend the two together and really help people take that full body evaluation and approach to really optimizing their health and wellness.
Yeah, that makes a lot of sense. Do you think there are things that have let me ask it differently. So what we see in every profession that is evolving and growing, that we're starting with people, or normally the people that we meet first are people who are jacks of all trades, right? That at the end, what we're left with, that once we go and search for those experts, as we are left with people who are choosing to do less, but are becoming extremely proficient in specific things, which are significant needle movers. So what do you feel, and we could definitely go from the inside out and both from the outside in, but what do you feel are the most impactful approaches you can take with someone once they walk, first time into your office, and how does it look like maybe like a year later?
So anytime a new patient walks into our office, we first want to understand what's going on in their unique body chemistries.
Yeah.
And so we usually will start with a diagnostic workup of some sort, whether it's a blood panel, an advanced testing panel, a heavy metal or mycotoxin panel, whatever that diagnostic is that's where we really have to start. We have to quantify, because your body is going to be different than mine, and mine's going to be different than Jackson's. And so everyone is unique, right? So we have to really understand each individual's physiology. And then from there, we can look at the individual components, but also the body as a whole. Yeah. And that's how we're able to put together a wellness or a longevity program for someone.
That's very important, because before you start like cueing the body, what you want the body to do, you kind of want to make sure you're tuning it up to respond properly, right? That's, again, coming from orthopedics, from this is the, we used to say, like, if a professional is an artist, you first need to make sure you have a good canvas.
That's right. So
you go through these tests. What do you think, going through like the 80-20 principle, what do you see, in 80% of people that are, maybe like bottlenecks that they have, or what kind of jumps out of the page as things that you see very often in your practice? And these are the things that are kind of holding people back or aging them faster.
Yeah, I think the thing that really jumps out as far as just a generalization is that we all deal with stressors in our lives, whether they're mental stressors, physical stressors, physiological stressors. And so the one thing that really I see so much nowadays is just our adrenal glands and cortisol and oxidative stress, right? Whether that comes from mental stress, whether that comes from environmental stress, whether that comes from physiological stress.
Yeah.
I think that's the one thing that truly jumps out at me as far as what I see day in and day out is our body's stress response and cortisol production and adrenal gland overstimulation. And it's a hard one, because that's one of those areas of our body that really touches every single organ system. Yeah. It affects your skin, it affects your hair, it affects your immune system, it affects digestion, it affects hormone production. It literally affects everything. And I think it's really a product of our environment. With stress and deadlines and work, and everyone is exposed to hazardous chemicals and poor dietary food sources and all of the things.
Yeah. And how does it look like? How does it look like both from a test standpoint, and also how does it then translate to, looking about, like talking about the outside, how does it then show up
Yeah. So diagnostically, we see it when we look at adrenal panels. We see elevated cortisol levels. And ultimately what that does is it puts the body into this kind of fight or flight mode, right? This overstimulated stress response mode. And then that translates into other diagnostic findings. So elevated inflammation markers. Then we start to see the hormonal shift happen. And then once the hormonal shift starts to happen, it can really affect every other part, vitamin and nutrient absorption, accelerated cholesterol and blood sugar metabolism or insulin resistance. It can really affect everything.
Yeah.
I mean, what do people feel in this type of situation? It's really everything.
Yeah.
It can be physical, whether it's feeling tired or run down or anxious or trouble sleeping. It can be cognitive with that memory, focus, concentration, recall. We see it, externally through aesthetic changes, right? So hair loss, accelerated skin aging, collagen loss, bone density loss. So we really see it kind of in a plethora of ways, but that is by far the most common thing that we see diagnostically.
That's, yeah, definitely. And so once someone is coming into your office, they get those tests.
Yeah.
First of all, how fast can you diagnose those things? Like, does it take a week, 2 weeks, a month? How fast can you collect the data and kind of point those bottlenecks out and say, hey, this is what we're going to focus on?
Relatively quick. None of these diagnostics take months to get back. So within a week or two, we're able to identify kind of root causes or why someone's experiencing what they're experiencing.
Nice.
Yeah.
So then what? Let's say we're experiencing. So obviously, keeping our discussion around common modalities, right? Not extreme cases. Hey, your house is full of mold. Yeah, that's of course, yes, okay.
Yep.
But let's say we're keeping it within those high occurrences. What are the next steps? Keeping in mind that people at the end of the day, especially people who listen to this podcast, at the end of the day, they want to make sure that they show up as their most beautiful self or youthful self. So what are the next steps after that?
Really from there, once we've really seen the extent of where these kind of stress response are manifesting in the body, we then just implement a plan to kind of address it, right? So one thing we know we have to do when we're in adrenal distress is we have to support neurotransmitter production.
Yeah.
Right? So things like dopamine and serotonin and norepinephrine and GABA, we have to support those neurotransmitters that are being so depleted because your body's in this constant stress response.
Yeah.
And that's easy, right? So whether it's a stress or a meditative technique, essential oils, we love contrast therapy, so cold plunging, saunas, great supplements that can help accomplish this goal, things like L-theanine and 5-HTP, great mushroom blends. We love doing that type of stuff. And then from there, we know that this is a process, right? We know your body didn't, physiologically change overnight. And so we're going to have to adapt your plan as we see that your body's evolving.
Yeah.
And then everything else is supportive, right? So if someone is coming in, their adrenal gland is dysfunctional and they're starting to really struggle with hair loss, for example, right? We see all the time autoimmune alopecia, right? So hair loss specifically because the adrenal gland is so overstimulated that it triggers an autoimmune response.
Yeah.
So like if we want to support that and, talk about hair rejuvenation programming, then sure, we can do a PRP or we can do a GHK peptide, or we can do an exosome treatment or stem cell treatment. We can do all of those things, but the key is making sure that you're addressing the underlying physiological issue, which is calming down that overstimulated autonomic nervous system.
Yeah, that's very important. And you mentioned a few things that I think are very applicable for everyone, but also specifically to people who need to use it as like an emergency break. So contrast therapy is very interesting because it kind of flushes out those catecholamines, right? These stress hormones in the brain, and almost it provides like a reset to that mechanism.
Yep.
And you guys, I mean, again, we talked off air about me and a bunch of other people getting stuck in that beautiful room that you have for contrast therapy. How do you see contrast therapy being used professionally or within a professional facility? And do you have any difference in recommendation when it comes to men and women?
Yeah. So contrast therapy just as a whole is an incredible anti-aging modality.
Yeah.
So on the cold side, you're getting this kind of anti-inflammatory stem cell stimulating response from the cold temperature.
Yeah.
So it can be really regenerative and really healing in any capacity. Sauna is really the same thing.
Yeah.
You know, with sauna, you're really getting that kind of vasodilation, that circulation enhancement. You're getting that catecholamine flush from the cold. So you're getting all of these physiological responses. And I think it's one of the most attainable modalities for people. You don't even necessarily need fancy equipment, although it does make a difference if you can go to high-end equipment or not. But, you know, you could be doing cold showers at home.
Yeah.
You know, you can expose yourself to heat in other capacities. So it's something that, you know, you could do very non-invasively and still have some physiological benefit. I do think that there are differences for men and women. Again, I think depending on what they're coming in for. You know, we know that, you know, obviously aesthetically speaking, both men and women change in different ways, hormonally and physiologically, and also at different intervals of life. So I think there are some differences in contrast therapy when you're talking male, female, for sure.
Yeah. And that's, but again, there is so much individual variance. So within that spectrum, I think it's going like low and slow and making sure. The other thing that you mentioned is kind of bridging between, I would say, like your end results, like what you want to get, and where you are now, and basically using those tests to then figure out how those strategies kind of add up. So how often do you retest to see that it's going to you know, in the right direction?
Yeah, I mean, our general rule of thumb is a minimum of 2 blood works a year. Ideally, we like to do quarterly blood work, especially if there is more of an acute, you know, moderate or severe pathology going on. Then yes, we definitely need to be monitoring and making sure that we're progressing. The other key with this is also recognizing that our bodies are evolutionary, right?
Yeah.
And they're going to continuously change over time. So if I put you on a wellness program today, it theoretically should not be the same wellness program 6 months down the road, because we know our bodies change. So I think having yourself monitored on a regular, ongoing basis is also really critical to make sure that you're still supporting your body in the way that you need to be supporting your body.
Yeah, that's very smart. Okay, now, you know, imagining these people who come to your office.
Yeah.
They're saying, okay, you got me through these tests.
Yeah.
Thanks. I might feel better. I might have more patience, or I'm not going to, but I want to look better.
Of course. That's what everybody wants.
First of all, do you jump right in with cueing the body for, you know, regeneration in the skin? Or are you saying, hey, first I want to make sure that that I'm preparing the canvas, and I want to make sure that you're a good responder? Are there variants to this? If you see someone who is on the healthier side, are you more confident in kind of going and stimulating regeneration, or do you first want to see like the labs and see what's going on?
Yeah, I think best case scenario, it's always good to recognize and identify underlying imbalances, right? But to your point, if we have someone who's healthy, they take really good care of themselves, they live a clean lifestyle, they're on a good supplement regimen, and they still have this aesthetic concern, by all means, at that point, we know we've got a great foundation to work off of, and we can implement whatever it is that treatment might be. Yeah. But I think in a perfect world, we always want to be helping people understand what's going on inside. That way we know is that hair loss from elevated DHT levels?
Yep.
Right? Or is it high cortisol? You know, are you experiencing cartilage loss because you're micronutrient deficient? Right? Are you experiencing collagen loss because you're under eating? Your protein intake or counts are too low, right? We could do any aesthetic treatment under the sun, but if we don't address those underlying contributors, we're not going to get to the long-term success that we're looking for.
Yeah.
So.
True. Okay. So what is, imagining a pyramid of things that one might do, and also that are that are effective.
Yep.
What would you say is at the bottom of the pyramid, maybe next to those testing and making sure we're addressing underlying concerns and issues? Are there things that you're saying, look, most of the time, or even all of the time, these are things that we're going to want to do in order to make sure that we are creating a better looking skin, better functioning skin?
Yeah, it's just the basics. It's living a clean lifestyle. So eating healthy as best you can, minimizing exposure to toxic chemicals and particles, and prioritizing sleep, hydrating properly, all the kind of more common sense things that we all know, but are sometimes hard to execute just because of, again, chaotic life and living. But I think that's the foundation.
Okay.
It's just about being a healthy individual. That is really the foundation, in my opinion, to just aging more gracefully.
I love it. So, what would you say, like, if I put there, by the way, I don't have an opinion about what I'm saying right now, but do you think glutathione, vitamin C, and let's start with those. Do you think they belong at that most basic level, and omega-3s? Do you think they belong in that most fundamental base, or maybe they are, up a little bit up the pyramid? Are they there? And you can address them obviously individually.
Yeah, I mean, I think those are ingredients that are incredibly impactful for everything about how our bodies function. I think if someone has the ability to incorporate those things on a day-to-day basis as part of their lifestyle, absolutely, they should be part of the fundamental group.
Okay.
Vitamin C from its immune modulation effects, glutathione from its, detoxification and antioxidant properties.
Yeah.
Those are definitely two foundational ingredients.
And obviously hormones, right? This is another thing that is a big factor in that, base layer.
Yep.
We now have also the FDA on our side, right? With changing of recommendations. But is that part of the basic testing that you guys are running, looking at a hormonal panel?
Absolutely. And again, I think the key there is recognizing that, a hormone problem is not necessarily a 40, 50-year-old person.
Yeah.
Right? I can't tell you how many teenagers we see nowadays.
Yeah.
And younger women in their 20s and 30s. And same thing, men in their 20s and 30s that are dealing with hormonal imbalances. And I think that's the key, right? We're not talking about menopause where hormones are deficient. We're talking about imbalances.
Yeah.
It's those imbalances that create the physiological aging. And so, yes, I incorporate hormones as part of our kind of standardized panel because it's that critical for everyone, especially when it comes to skin and aging.
I agree. And the crazy thing about hormones is that this is not, I think most of us are used to think in extremely aggressive decisions and kind of life changes or strategies rather than cumulative, micro steps. And I think hormones are almost thought of it like that. The same way you're going to talk to like a 40-year-old woman, she's going to say, look, I'm holding off to get a facelift at 50. That's almost like people are addressing like balancing their hormones. Like I'm waiting until the wheels fall off and then I'm going to address my hormones. Dude, if your hormones are not optimal, you are aging in a more rapid fashion than you would otherwise. So I definitely,
Yeah, the one comment that, again, I literally see multiple times a day, and it crushes me every time a young lady says this to me is, oh, well, I was put on birth control to calm my skin down.
Yeah.
And it crushes my soul, honestly, because again, it's one, clearly there's an issue here, right? And two, the hypothetical solution, birth control, is actually making the problem worse.
Yeah.
So I just see it. So thinking about hormones, has to be something also in younger people's mind and on younger people's radars as well.
Yeah. How do you set a strategy around birth control? Is it something that you're saying, hey, enough? Or are you saying, well, that's going to be your decision. Here are the pros and cons, but I'm going to have to make like different decisions and recommendation around it?
Totally. I will never tell a woman to not be on birth control.
Okay.
Right? Like, I am not that type of provider. My job is to educate you on the advantages, the disadvantages, and what we can do to help support you as best as we can. So I don't want to come out here and sound like I'm completely against birth control. I'm not.
Yeah.
But we know it does create some physiological changes downstream that generally are not great for most women in particular. So again, if someone comes to me and say, listen, I have to be on birth control for contraceptive purposes or for whatever the reason.
Yeah.
Great. Perfect. Let's figure out a plan with you on the birth control where we can still support your hormones so that you're not having some of these other secondary effects.
So what would some of those things be that you could do around birth control?
So again, going back to things like making sure cortisol and adrenal gland is supported appropriately, making sure that, we're supporting thyroid health.
Yeah.
Making sure that nutritionally things are good or digestively things are good.
Yeah.
Those are the areas that we can support to try to mitigate or minimize the negative impacts of the birth control on the body.
Mm-hmm. Is it something that you are kind of also talking about when you're talking about GLPs? Is it something that people are now, is it the new birth control in the aspect of like, hey, I'm coming to you, I'm already doing this modality. Now it's either you're going to get me off of it because I'm nutrient deficient to some extent, or we now need to work around it? Or are you saying, hey, I'm fine with people doing GLPs, I'm not even going to tell them the cons? How do you address it?
Yeah, I mean, so with GLP right now, obviously such a huge area of our healthcare space. Again, I think when they're implemented properly and monitored properly, and you support the body in the proper ways, there is no downside to a GLP. In fact, you could make the argument that GLPs can be beneficial to skin.
100%.
Right? So
from an inflammatory modulation point of view?
Correct. Yeah. And what about the fact that we know GLPs help insulin resistance? Insulin resistance can really help hormones and help skin. And so, again, I think when implemented appropriately, patient by patient, I have zero downside when it comes to GLPs.
To the extent that you think that in the future, obviously this is super tentative, but with the sophistication of GLPs, like now we see like Red 4 or something like that, do you think at some point we're going to have GLPs that are implemented only for their longevity benefits, or even like, I don't know, like skin health benefits or brain or something like that, and they're almost used like another peptide in a stack?
Well, I can tell you right now it's happening. I mean, in my clinic, I think of the people that we use GLPs on, if I had to guesstimate, I would say 25 to 30% are for non-metabolic usages. So these are people who are using them for longevity. These are people who are using them. We know there's new research emerging now on GLPs and neurocognitive decline. Right? So these are people that were using GLPs for nothing to do with weight management, nothing to do with skin, but these are longevity protocols that we're using with these GLP-1s.
I love it. And so are there things that you are still wanting from the, like, you want GLPs to become more refined, or are you fine with GLPs the way that they are now? Is there anything missing in that picture?
I think the longer that they are in clinical use and have the ability to be researched and studied, I think there will be even more emerging data on GLP-1s. What we know right now is still great, though. Right? As we talked about, we're learning about all of these other cellular and biological benefits. But I think it's going to continue to refine itself. I do.
So right now, how is the dosage or ratio different between the recommended, the official recommended dosage for, obviously for now it's for obesity, so dosage for weight management and for longevity? Is it a 5-to-1 ratio or 10-to-1 ratio?
Yeah, it's definitely a significantly reduced microdose, we call it. I probably would say, compared to traditional applications, I mean, it's probably 20%, it's probably 80% of what a therapeutic dose would be. Somewhere between 50 and 80% of what a weight loss dose would be.
Yeah. Okay.
Absolutely.
Fantastic.
Yeah.
And in most cases, also for weight loss, it's kind of overdosed, right? It's kind of overprescribed, overdosed.
Correct.
Yeah.
Yeah.
Within this, one last question that I think most people are not understanding when it comes to GLPs, are blood work and in general testing do these things need to be modified as far as fasting, as far as reading the results when someone isn't on GLPs?
I will not prescribe a GLP without some basic set of blood work.
But how about the inverse of that? So we don't have the same gas emptying. We don't have do these things, that the amount of time it takes your body to kind of interact with nutrients when you're on GLPs, does it skew results to an extent where you're going to read results differently or prepare the patient differently?
If these are dosed correctly, it should not.
Okay.
It should not negatively impact the physiology where you have to kind of, alternatively interpret blood tests.
Okay.
Yeah.
That's interesting. Great. So we have that patient, the imaginary patient.
Yes.
We've kind of gone through that base level, which, honorable mention to sleep hygiene, honorable mention to meditation, mindfulness.
Yeah.
Now what? So what is the next layer in creating the most functionally good appearance with that patient?
I think we start talking about some of these advanced modalities, whether it's through, again, these ingredients, things like GHK, right? Things like methylene blue, right? These are kind of what I consider to be kind of that next tier after that foundation is established and supported.
And just not to be confused, because we do talk a lot about these ingredients topically. Now we're talking about introducing them to the body in the most bioavailable way, which means, either injections, IVs, or oral in the case of, methylene blue.
Correct.
So how do you see GHK? So first of all, let me ask you a question. How do you feel about, you mentioned GHK-Cu. Now it's extremely common to have the glow stack or the close stack, which is, so glow stack is BPC-157, TB500 or TB4, and GHK-Cu, and then a lot of people are adding KPV for anti-inflammatory purposes. Do you feel these stacks are kind of an advanced way to introduce the effects of GHK-Cu into the skin, or are you first starting with GHK-Cu solely?
I think you have the ability to start with GHK by itself, for sure. I think it really just depends on your goals.
Yeah.
Again, I think in a perfect world, if you can combine these components together, it's going to yield you an accelerated response, and I think a more robust response.
Are you saying it from a budget point of view or from a multiple injection point of view?
From multiple injection point of view. Yeah. And just think about, all of the physiological change that's happening when you're using GHK-Cu by itself versus in tandem with some of these other components.
Yeah.
So I think from an effective perspective, if you have the ability to do a stack of these things together, chances are it's going to probably yield you an even better outcome.
And so you mentioned GHK-Cu and you mentioned methylene blue. How do you interact with methylene blue? What is kind of your approach to introducing it to the body, and then how do you make sure the body, you yield the best results out of interacting with it? Yeah,
so methylene blue, we can start through oral supplementation, whether that's in compounded capsule format, liquid tincture format. And then really we do a lot of methylene blue intravenously. For the most bioavailable efficacy. And again, it's a fantastic ingredient, not just aesthetically, but for just longevity. And we were talking, so cognitively, we were talking earlier about cortisol for adrenal support. It's just a phenomenal compound in general, but specifically in those areas. We love administering it IV.
Yeah. Do you do it always in conjunction with red light therapy, or is it not a must?
Not a must, in my opinion. Not a must. Again, I think it's beneficial or more symbiotic to do them together, but not a requirement.
Nice.
Yeah.
Okay, so these are okay. So let's talk about GHK-Cu a little bit. We have talked about it before, but let's imagine we didn't. Why do you think? What is special about that peptide? Why are we seeing? What are kind of the primary kind of maybe things it's touted for, and what are some of the hidden benefits that are also associated with GHK-Cu?
Yeah. So obviously, it's a very commonly known peptide in the aesthetic space, right? So we're talking about mixed connective tissue development and regeneration. So everything from collagen to cartilage to elastin and fibrin to blood vessels to nerve and those connective tissues. So all connective tissue regeneration, just incredible regenerative capacity with GHK-Cu. I think one of the other things that kind of goes unrecognized about that peptide is these connective tissues, although we always think about them aesthetically, you need just as much collagen in your knee joint as you do in your face.
In your gut.
In your gut.
Whatever.
Correct. And so I really think that's an area that, oftentimes doesn't even get discussed. But GHK-Cu has pronounced benefits to other aspects of your body. And again, because I come from an orthopedic background, I'll stick GHK in a joint.
Yeah.
I'll do a BPC GHK combo and I'll stick that in a joint.
And you see more a better response than injecting it subcutaneously to your belly fat.
Yes.
Interesting.
Yeah, if the concern is truly an acute isolated joint, then yes.
Interesting.
I will stick that in that joint 9 times out of 10. I think you can continue to do systemic injections to continue to enhance that global anti-inflammatory effect. But that's definitely one of the things that we see with GHK-Cu is we'll use it for other applications other than aesthetic.
That's really cool.
Yeah.
And one of the things that is tricky about GHK-Cu, because it has so many levers it's pulling, many people regard it as a peptide that you don't need to come on and off from, whereas other ones, such as, I do argue a lot behind the scenes with people, but I'm like, no, listen, obviously most of its effects are non-receptor occupying kind of effects, but some are. It does occupy some receptors, and you do want to kind of give these receptors, which are kind of these, lock and key type mechanisms, kind of time to rest and kind of rediscover their sensitivity, if you would. What is the usual cadence of usage of GHK-Cu? When it's recommended and prescribed?
So I think for systemic usage, whether it's, oral, injectable, IV, etc., I generally like people to be on 3 to 6 months with, a month off.
Yeah.
Just giving your body that little break. So to your point, those receptor sites can resensitize or, downregulate or whatever the case may be. For some people, I do like it longer term, depending on the situation. Like, if we have a patient who comes in and they're dealing with a chronic wound that just won't heal.
Yeah.
Right? That's a little bit of a different scenario where, okay, that's probably a longer term application.
Yeah.
Or again, like if I'm going to inject around that wound, or if someone comes in post-surgical and I'm injecting the copper peptide around the incision site, that's a little bit of a different story.
Yeah.
That's a little bit maybe longer term usage, but I think on average, 3 to 6 month window is great. And then just give the body a little time to kind of reboot itself, resensitize with a couple weeks or a month off.
I love it. So with things like BPC 157, TB 500, people, because they read online and ChatGPT told them it's really good for their healing.
Yeah.
You almost need to set the stage to tell them, hey, you probably are not going to feel anything for like 4 to 6 weeks, and then you're going to feel like Wolverine. What are the typical kind of loading period of GHK-Cu? When do you start seeing the results? And I have a follow-up question, but let's start with that.
Yeah, so I think aesthetically speaking, I would probably give it a very similar timeline, right? We're talking about regenerating connective tissue. That doesn't happen overnight. So if you truly understand the physiology of how our body creates those tissues, we're looking at 4, 6, 8 weeks for that process to really be substantiated enough where you can tangibly see it.
Okay, so going towards the stimulative treatments that then call on repair in your body, and obviously communicate very well with those repair supporting modalities, such as microneedling, and we can get into other ones. Microneedling is just something everyone, I think, have a pretty good understanding of how it works. Is it something that you want to initiate when you start using those modalities, peptide modalities, etc., or are you kind of holding off kind of towards the end of that loading period in order to time it better as far as how the body responds to the stimulation?
Yeah, usually the latter. Usually kind of waiting for that body to make sure that we get a really strong response from the micro trauma or from whatever the stimulus is.
Okay, so what are some of the other things that you would say? I tried, I say it in every podcast because it's annoying. I tried to trademark prejuvenation, and I got an LOL back from the USPTO, the Patent and Trademark Registration Office. What are some of the other modalities you're gonna kind of prescribe in order to kind of prepare the person for the best response out of stimulatory processes?
Yeah, I think a lot of the foundational things we were talking about. So those are, we'll say, okay, we know everybody should be doing these things, right? So that I think is first and foremost. From there, you can incorporate other technologies. We love infrared. It's an incredible preparatory modality. We love micronutrient IVs. I think those can be great preparatory, modalities. We're huge and we're fortunate enough to have 2 of them, but hyperbaric oxygen chambers. I can't think of a better preparation modality than hyperbaric oxygen. Ozone treatments. We love doing blood ozone IV treatments in in preparation of these types of treatments. Those are all definitely like next tier, top tier types of things, but they really prepare the body for a treatment.
That's interesting. So, looking at hyperbaric oxygen therapy, would you say, so there is a lot of, if you talk to the purists, the people who are, dealing with treating non-healing, ulcers or, dealing with divers or something like that, a lot of them, just because of their vantage point, they don't want to capitulate to the notion that this is an anti-aging longevity modality. They're like, no, here's what I'm doing. Please don't talk with me about anything else. And then there's people such as yourself or Dr. Jason Saunders or whoever, is the kind of the person you speak with. They're like, no, this is the strongest thing you can do to affect multiple systems in your body and kind of cover a lot of bases as far as like longevity is concerned. So the first point is, do you think everyone should be doing some kind of hyperbaric approach when they're trying to optimize their longevity, function, etc.?
With 100% certainty, yes. Other than maybe stem cells or exosomes, I cannot think of anything that is as powerful from an anti-aging perspective than hyperbaric chambers.
And even, a lot of the things that hyperbaric does do then relates to stem cells and exosomes, right? So what is the approach that you would take with a person that is healthy? So obviously, again, like we talked about, weeding out the 1-2% that are not going to be applied there. Obviously, if someone has like really bad mitochondrial function, that might not be the case, even with other modalities, even with sauna, right? But what is someone that you're trying to optimize their health, maybe optimize them towards that stimulatory treatment? How does interacting with the hyperbaric oxygen chamber looks like.
Yeah. So in a situation around a medical treatment or an upcoming medical treatment, we like to usually front load, on the front end of that before whatever the treatment is or surgery that's going to take place. Generally a minimum of 5 to 10 sessions. 5 to 10 is really where you start that physiological cascade of rejuvenation. And it's always cumulative.
Yeah.
Right. So on the post end of treatment or surgery or whatever the case may be, as many as you can do after, because it does have cumulative effects.
Yeah.
So if we know someone's going in for, a non-invasive facelift, and they're scheduled for surgery, 2 weeks from now, we definitely would encourage them to do 5 to 10 treatments.
You got to start now. Get out of their pre-treatment.
That's right.
Yeah. Okay.
That's right. And then the same thing on the back end. So after surgery, you want to accelerate healing. Again, nothing better than hyperbaric oxygen.
Yeah. So let's say we removed that surgery. How would someone interact with the hyperbaric oxygen therapy chamber when it's just a beauty or longevity, longevity treatment, right? Like, so how do you interact with it to improve your health for life?
Yeah. So in that case, what we need is the consistency.
Yeah.
Right. So maybe we do a once a week, but you continue weekly.
Yeah.
Or maybe you're doing multiple sessions a week.
Yeah.
We like to kind of have it be part of that normal routine for people, because that's how you'll accumulate, accumulation.
Yeah.
Time in the chamber. So if it's more just kind of longevity, overall health and wellness, or even something maybe musculoskeletal, I think just making it a part of your normal routine and regimen on a somewhat consistent ongoing basis is the best way to do it. You'll hear people talk about you got to do 40 dives, right, in order to get an effect. And I don't really agree with that. I think if it's more for longevity, anti-aging, overall wellness, I don't necessarily say that you have to do an initial series or package. I think it's great if you have the opportunity to do that, but I don't think that you have to commit to something like that on an ongoing basis.
But you're saying it might be a better idea to start with, 30, 40, basically 5 sessions a week for 4 weeks or something like that, or 6 weeks or something like that. But if that's not something that you can do because you got to work or something like that, once or twice a week, ongoing is fine.
Absolutely.
Interesting. By the way, within that aspect, that's by the way, the first time it occurred to me, is there either anecdotal data or studies looking at combining methylene blue and hyperbarics because of that oxidative stress that you're increasing?
That's a good question. And so to your point, methylene blue is one of those things that can mimic the physiological effect of hyperbaric.
Yeah.
So for people who are claustrophobic or for people who just literally can't get in the chamber, methylene blue is the next closest thing.
Yeah.
There's very limited data to my knowledge on the two therapies combined.
Yeah.
Just because it's hard to find true good data on one of those therapies and then the two of them together.
Yeah.
So very limited, if any, honestly, in combination of those two. That's actually one of the things that we're working on, though. So one of the things that we're working on at our clinic is looking at these in-house antidotal objective markers.
Yeah.
So we can track, how many hyperbaric sessions, how many methylene blue IVs that you've got, and we can look at data points like your anemia markers or your cortisol levels or your HRV scores. That's one of the things that we're actually working on in our clinic.
It's really cool.
Yeah.
Okay, so we did those modalities, those front-loaded modalities, which is very interesting. What are some of the things that we can do that are stimulatory, or maybe is there something between those two? So we're left with that second layer of the pyramid. We're talking about the peptides that are directly linked with skin repair and rejuvenation. We talked about hyperbarics, other things like that. Are there any things that do you think are more fundamental, or that we're going to front load first before we get into stimulatory modalities?
No, I would probably say those are the two tiers or levels that I would say in preparation of that treatment.
what comes next? Like, what are the, I don't want to say heavy hitters because that's not the right heavy hitter is go get a facelift, right? Like, what are the most handy tools to communicate with someone on a biological level to improve their skin quality and appearance?
I really look at those kind of regenerative components, things we were mentioning earlier, you know, so stem cells, exosomes, extracellular vesicles, growth factors, those types of things.
Yeah. And you're doing them, how do you introduce them into the body? Do you do them together with microneedling, or you're saying, hey, forget about microneedling, just get them in an IV. It's going to be significantly less,
Invasive, yeah.
Invasive.
Yeah, we always recommend a combination. You know, we're administering these therapies systemically and then also aesthetically at the source.
Yeah.
Right? So whether it's through microneedling, you know, topically microneedling with injections, in combo with IV or systemic injections. We always prefer to do it that way because, again, it's going to have more of that global response and global effect.
And what I loved that when we did it, one of the things that we talked about, and I think is a fantastic thing to take on, is also NAD injections, which you guys have a great source. Like, I love the NAD injections that you guys have. Is it something common that people kind of combine the two?
Yes.
Yeah.
Yeah. I think NAD is another one of these really trendy right now.
Yeah.
Like methylene blue is. But, you know, NAD we've been using in clinical practice for almost 5, 7, maybe 10 years. So yes, it is another one of those great kind of mid-level tiers that can really help get the body ready for whatever advanced treatment is going to be happening, and then also really help the body recover from whatever that treatment is going to be as well. And to your point, you know, injectable and IV is really the way to go with something like NAD.
Fantastic. So yeah, again, talk about cumulative. That's also something that we kind of want to, have before, have after.
Yeah.
So where are we right now as far as stem cells, exosomes, biologics, and microneedling? Where, if you talked 10 years ago, sources were not fantastic or were problematic, let's say. Different approaches, different protocols. Like, where are we? How do you look at like good sources right now? Where are we as far as like how often do we need to do them? And where do you think we're heading? What is missing?
Yeah, I think the industry and these treatments in particular, they're definitely the now. I think people sometimes still talk about them as, yes, they're going to be the future. They're not the future, they're the now, right? The science and the capability and the exposure has been so much in the last few years that these are readily available treatments now.
Yeah.
I think the differentiator for most people is making sure that you're using good quality goods and good sources of these compounds, because they're not all created equal.
No.
And you do have to work with someone that is using top tier products and goods, because otherwise things can happen, right? These are medical procedures. So, you have to make sure that you're having them done appropriately with good quality goods and well-trained professionals, etc. But I think it's a now. I think these are things that people need to be making as part of their aesthetic regimen. We really educate people on, doing a regenerative microneedling once a quarter, twice a year. And that's in addition to just your normal monthly facial or your normal less invasive microneedle or your quarterly lasers, or, it has to be part of your ongoing skincare routine throughout the course of the year.
Yeah. I mean, first of all, I'm not only not going to name names, I'm going to take out a lot of information to make sure that I'm not putting someone on the spot. But Anastasia and I went somewhere. And we heard the person that is regarded as one of the top consultants or aggregators of information, which then she recommends kind of what plastic surgery you should do, when, with whom, etc. Maybe get you a better price, whatever that is, schedule you, etc. Yeah, there is a job like that. And I raised my hand and I said, how are you regarding biologics? Where are you incorporating them? How do you see doctors recommending them? And her response was basically very, not towards me, but towards the modalities, very dismissive. FDA says X, we're not dealing with experimental technologies. I don't recommend them currently. And I was appalled because how can you not recommend someone that is widely considered just a force multiplier, by the way, not even from a result standpoint, how about from a recovery standpoint, right? So that's like the anecdote that I have to why you should really go after someone that has done it for a long time and is really immersed in it, because within the same field, you have people who are still resisting it and thinking it's a 5 year from now, modality, which is insane to me. So one of the things that is very exciting to have you here is because you are, I talk a lot about A4M, American Academy for Anti-Aging Medicine, and I said for us as a company, it's a tool to understand what the doctors that are going to be talking to our customers are going to be telling them, because that's the source of truth, source of information within the field. But you are one as well. You give courses and lectures to providers who then do these modalities. What are the most important, where are those people at? What are the information pieces that you provide those people to give them value within those parameters?
Yeah, I mean, so yes, for us in our practitioner training events and programs that we offer, it's about guiding practitioners on the right ways, the wrong ways, the safe ways, the unsafe ways, the good vendors and distributors of these things, the people who are selling snake oil. It's really about helping to educate other practitioners so that we as a field don't have all of these extra hurdles to have to overcome. Because all it takes is one person for functional medicine to now have to overcome another hill. Right. And so for us, we're excited about the opportunity to educate other practitioners about what we do and how we do it and why we've been so successful, because it's going to help the industry as a whole.
I couldn't agree with you more. I don't know, we don't talk about it much, and again, I'm not going to name names, but we've been developing vampire exosomes, which by the way, the launch party was
so amazing
at you guys' facility, which was so fun.
We are so happy to have you guys.
And we had a long time to work on it. The part of the reason is because there was a kind of a point of there was a point of worry around September 2024, where everyone were waiting to see how the FDA is going to update their regulation about topical kind of shelf available human-derived factors. And at that point, we've had the product ready maybe for a year. And one of the things that I said, hey, this is actually a great opportunity because I'm going to accomplish a dream. And we are going to publish per batch the analysis of what's inside the exosomes, because most people aren't aware that exosomes are a vehicle to the actual signals, and it's on its own is actually the empty outside part of that complex. What's inside is what matters, and that has nothing to do with a selling point. No one. When you're the only one doing it, you're in a vacuum. No one's talked about, no one educated anyone about it. It's empty. If people know you and buy you already, they already are past the point of caring. And if people haven't heard about you, they're pre-point of caring. No one knows. And the only reason we did it, and by the way, why did I say I'm not going to name names? Because when we went to very reputable providers of exosomes or labs that that kind of that analyze human-derived tissue, the quotes were, we're going to have X amount of millions a year for us to open that program. And so it took us a long time to kind of find a way to do that. But the idea was not, there's nothing that benefits young goose around it. It's the hope that the industry is going to follow suit. And even if you choose a different product, at least you're going to get some kind of, guarantee that you're actually getting what you're paying for.
Yeah.
You do see that more in sterile product that's going to be injected, right? That's one of the parameters you're looking for to see what's inside the exosomes and how you deal with them, right?
Yes, you have to see stuff and feel confident about that type of information.
Yes. When you talk about exosome stem cells, what are some of the things you are looking for to the positive and to the negative?
We look at how the specimens are collected, right? How they're processed, what their preservation process is like, because you could do all the right things, but if you don't preserve it the right way, it's going to taint the goods, so to speak, right? How is it distributed? How is it marketed? How much ongoing audit do they do and check for quality? What kind of testing do they look at? Those are like really critical factors when it comes to these types of regenerative cellular components. And you just have to work with companies that are doing all those things. Because otherwise you're really compromising, again, these are invasive procedures. Although we love to call them non-invasive, they're invasive. You can kill someone. People can die. So you have to do the right things and take the right precautionary steps to make sure that, what you're using is the best of the best.
Yes. It's actually funny because, again, I myself cut my hair today, and I referred two people that own that salon to you guys because they were talking about buying peptides online from, and they, again, they threw them some names out there. And the example I always like to give is Long Island. I don't know, but I think it's already 10 years ago, where tens of elderly people got admitted to the hospital with liver complications, liver failure. And they found out that all of them had one common denominator. They all took B12 capsules from GNC. And what happened was that contract manufacturer for basically like a private label for GNC, were making in the same facility, in the same vats, they were making anabolic steroids. And they didn't clean them well. And they had some anabolic steroids in their B12s, and that's kind of what happened. And the reason I give this example a lot is because this is where you would not expect anything to go wrong, like whatever GNC is making and selling as their own brand, right? So it's when we're dealing with something that could really, really mess you up, it's obviously so much more important to make sure you're dealing with the right producer, supplier, etc. What are some of the concerns that people have that are a little bit, I'm not going to call them silly, but they're a bit irrelevant? We hear a lot about are there DNA strands or remnants, or are the donors vaccinated? We hear that a lot. Are you getting those questions too?
All day, every day. And they're valid questions, right? Those are really important questions to be asking. And again, you just have to find people that can answer them correctly and confidently. So again, any really safely done, well done human cell tissue product, is going to contain no DNA. Right? That section of the umbilical cord is actually removed. Where the DNA lives. So that's first and foremost. So again, chance of rejection, immune response should not happen. We certainly get the question all the time, especially with stem cells and exosomes. Well, is it going to cause cancer to grow? That's a big one, right? And again, the answer is, well, anything is hypothetically possible, right? But it's hard for even in a laboratory setting, for them to create that situation to happen. And our body actually is built and coded with many defense mechanisms to protect against that from happening. So in medicine, and my response to this is always, well, in medicine, we always weigh the pro versus the con. And in most cases, the hypothetical pro of a treatment like this is going to outweigh the hypothetical con.
Yeah.
And that's how we kind of base our decision-making process. So we get a lot of those very common questions all of the time.
Yeah. Vaccination, do you get a lot or no?
All the time.
Yeah.
All the time. We work with a tissue company that actually now is only accepting non-vaccinated donors.
Really? Interesting. One of the reasons we opted for platelet-derived exosomes is because those, first of all, DNA doesn't live there, but also spike protein does not exist within that tissue. So interesting. Yeah, that's another way to solve it. But obviously the best is just to screen out people who are vaccinated.
Yes.
Super cool.
Yes.
Yeah. So Joe, what else is what is it that is at the top of this pyramid as we come to an
this is a big tall pyramid. I don't know if it gets any higher than this.
That's basically it. So you said maybe,
I think so.
Yeah, maybe like the quarterly or semi-annually lasers, peels, things like that. This is obviously it needs to be an optimal patient.
Yes.
Fantastic.
Yeah, I mean, I think those are about as, for right now, I think those are about as regenerative as it gets. Human cell tissue products, a lot of these ongoing kind of moderately invasive treatments and procedures. And really, I think, again, it just boils down to foundation. Yes. That is the key with all of this.
Yeah.
Right? Because there is no amount of stem cells or exosomes that's going to completely counteract a really unhealthy lifestyle.
Yeah. Yeah.
And I think that sometimes get lost. And, in this country, unfortunately, everyone wants the quick and easy fix.
Yeah.
And sometimes people are unwilling to put in the work and the things that they can control. But I have no trouble saying no to someone. If someone wants to come in and do this invasive, elaborate procedure, but I know because they're not the healthiest person or they're not going to follow instructions, I will say no.
Incredible. Yeah.
Because you have to, because then they're not going to get the outcomes. It's going to come back to you eventually. And you don't want that as part of your reputation. We want to be good healthcare practitioners.
Yeah.
And put people in a position to have the best success possible. And if that means, listen, show me over the next 6 weeks or 6 days even that you can at least get yourself into a more healthy lifestyle and healthy habits, then I'm willing to meet you in the middle and let's do this together.
Yeah.
But show me and prove to me that you're going to do the work on your end so that way we can all have the best success.
100%. I still remember Dr. Miami getting a lot of flack. I mean, that's again, 10 years ago for not wanting to take on any patient that's over 50 years old. By the way, you could give him a hard time for it, but his explanation was, I have enough people to choose from, and I want to make sure I have people who respond to what I'm doing in the best way.
Yep. I have the same rule.
Yeah.
I won't treat a smoker.
Yeah. Wow.
I don't care what it is for. I will not treat a smoker.
Interesting. Is that your approach about nicotine as a whole, or are you saying that specifically about inhalation, vaping, and obviously smoking cigarettes?
That's a whole nother topic for a whole nother conversation. But I will give you the quick and dirty is really I'm talking mostly inhalation.
Okay.
I think people who are supplementing nicotine orally or vaping, again, I will not say a hard no, but that's something where, again, that education's got to be there.
Yeah.
And it's generally something I kind of advise against. But an active smoker, won't treat them.
I love it. Okay, Joe, you are a treasure trove. We're gonna have to think of a subject for next time where we're diving deep into one thing.
I would love to.
It was such a great topic, but topics kept coming up.
Yes.
I didn't even look at the question.
Oh, no, I love that.
So let's divide as far as like how can people interact with you. First of all, let's talk about R3 Med House.
Sure.
West Palm Beach, Florida.
Yep.
How does that go? How can people work with you? How can people learn more?
Yeah, so R3 Health in West Palm, that's our functional medicine practice. So if you live locally in the South Florida area, wonderful, come in and see us. We're here in West Palm Beach. But we also offer a full tele and video medicine platform. So currently we service patients in 30 different states and 10 different countries.
Wow.
So if you have any interest in exploring your health and more of that kind of functional or integrative medicine approach, just send an inquiry. r3health.co, because we can work with you no matter pretty much where you are. Not everywhere, but we do have patients in 10 different countries.
And I can say that we are so lucky that we have you guys really close to us, that we can take advantage of it. And again, it's really fun to be able to bring the people that we trust to the podcast.
Same.
So that's as far as like that. If someone's a practitioner, because I think we have, I don't remember the statistics, but we have a lot of people who are practitioners that are listening to this podcast.
Yep.
How can they, get you? How can they get the training from you? How does that go?
Yep. So in addition to R3 Health, we have the R3 Health Network, which is our practitioner training arm. So you can reach out to us, go to our website, R3 Health Network. You can even just reach out to us on the R3 Health website as well. If you're a practitioner and you want to get into integrative or regenerative medicine, you're just not sure where to start or how to start, we have all kinds of training programs that we can help you get going. So definitely reach out. We're actually really excited. We're hosting our first live big event here in West Palm in December.
Wow.
And so there will be more of these big live events coming up as we continue to grow that aspect. But yes, if there's any practitioners out there and they want to be getting more into functional medicine, just reach out to us.
Amazing. Okay, Joe, thank you very much for your time. It was so fun.
So great to be here.
It.
Thank you for the invitation.
Absolutely. All right, everyone. Thank you very much. Bye.